We have a question in the question and answer, and it may be a question that a number of people have, so I'll just respond to it. The recordings will be distributed through the ASPE strategic planning website. We're still setting up how that site is going to look, what the links are going to look like, all of those kinds of things. So once we have the recordings from all of the trainings and the ancillary materials, we will post them on the ASPE strategic planning site that's on the intranet for HHS. And you will be able to access the recordings, the slides, and any handouts from each of the sessions at that time. I anticipate it'll take at least a few more weeks for those materials to be available. And through the same channels that we send out the invitations to these sessions, we will send out the information about how you can access the materials. So it looks like it's a couple minutes after 1. We will get started now. Thank you, everyone, for joining us. We really appreciate you spending time with us today. And I hope that you all are as excited about this session as I am. And why we're doing this is as part of HHS's response to the Foundations for Evidence-Based Policymaking Act, or the Evidence Act, we assess departmental capacity in a range of evidence-building areas. One topic that people requested was information about different approaches for generating high-quality evidence. And so during this session, you will learn about the realist approach to evaluation, and you'll see a range of opportunities for realist evaluation and understand how realist evaluation might apply to your work. Before we get started, though, I would like to go over the housekeeping items. And the webinar is being recorded. As I mentioned, the recording, the slides, and other materials will be available on the ASPE Strategic Planning Resource Center. We're hoping in a couple of weeks, but we are recording this so that you will be able to look at it, on your own schedule at a later date. If you have questions for the speaker, please put them in the question and answer tool, and you can do that throughout the presentation, but we will reserve time at the end for answering questions, I should say. And you can access today's PowerPoint and a related handout through the chat. So those will be posted in the chat. Also, to let you know, we have another training coming up September 14th on communicating technical information. And so we will put that information, the link and the blurb for that in the chat at a later point in today's session. So that is our next session in this whole series of capacity building. I'm going to turn now to introducing our speaker. As I said, I'm very excited about this session and interested to learn more about realist evaluation. And our speaker today is Dr. Karen Minyard. Dr. Minyard has led the Georgia Health Policy Center since 2001 and is a research professor with the Department of Public Management and Policy at the Andrew Young School of Policy Studies, at Georgia State University. Dr. Minyard has applied a realist approach to much of her work over the last 6 years. And this work involves multiple projects, the largest of which included 8 rounds of sense-making over 5 years to revise the original literature-based theory about health systems transformation, a topic that I'm sure is very dear to many of our hearts. She maintains her connection with the communities by working directly with local health collaboratives and serving on the boards of Academy Health, National Network of Public Health Institutes and Communities, Joined in Action. And she received her bachelor's degree in nursing from the University of Virginia, a master's degree in nursing from the Medical College of Georgia, and a doctoral degree in business administration with a major in strategic management and a minor in healthcare financing from Georgia State University. And so, as I've said in the previous ones, she has many extensive credentials, but she's also very personable. So I think we're going to enjoy this session very much. And again, if you have questions, please type them in the question and answer session, and we will be reserving time for that at the end of the session here today. So it is my distinct pleasure to turn things over to Dr. Minyard.
Thank you so much, Susan, for that kind introduction, and I'm happy to be here with you. This is a topic that's of a lot of interest to me, and I'm going to share my screen. and begin. I have kind of fallen in love with this realist approach to gain insights because of our rapidly changing environment. And I like being able to think about how things work, why they work, and how they work in different contexts. So I'm going to give you a quick overview. Before I do, I'd like to just say a little bit about the Georgia Health Policy Center. It was established in 1995. It's a research center within the Andrew Young School of Policy Studies at Georgia State University. We do a lot of work in research, program development, policy guidance, and are involved locally, statewide, and nationally. We've worked with over 1,500 communities, states, and territories, and we've also got a new portfolio of work in Ireland, Kenya, Nigeria, and Sudan. I was just on a call with some folks in the Health Policy Center. They were planning their trip to Kenya, and I'm really interested to hear what they do and how that goes. So we wanted to start out with a polling question about your experience with a realist approach to evaluation. So if you could respond to the poll, you've never heard about it, you know a bit about it, you've seen it in action, you've used the results, or you practiced realist evaluation yourself. Could you take just a moment to complete the poll, and then we'll look and kind of see the experience with realist approaches in our group that are here today. Okay. All right, so it looks like we had 57 respondents, and that the majority of people are early in their work with a realist approach, but it looks like we have 3 people who have actually practiced realist evaluation. So I would encourage you to share insights and ask questions. Those of you who have practiced it, don't hesitate to add something. Those of you who are early in your work or haven't worked with realists before, don't hesitate to ask your questions, and perhaps we'll be able to have a bit of a conversation at the end. Thank you. Okay, so when I think about what we're dealing with, this transformation of health, public health, human services in the United States is considered by many to be quite a complex, maybe even a wicked problem. And this kind of challenge that we're facing creates a need and an opportunity for us to have new methods to understand what's going on and to think about what are the best theories and practices and programs that we might want to employ. I love the work of Scone. He talks about the swampy lowlands, and he says, rather than speaking of trial and error, human intuition, and muddling through, program managers and their evaluation partners will be armed with evidence about what works for whom in what circumstances. And this is true in many of our engagements. So this basis of what works for who, how, in what circumstances, is the core of the evaluation work that uses a realist approach. And thinking about a realist approach to evaluation, you're wondering, how are the outcomes caused? How do the interventions change mindsets and reasoning that leads to different kinds of decisions? What is the influence of context? How does context influence reasoning? And maybe certain mechanisms only work under certain circumstances. The realist evaluation approach is about theory building and theory testing. And there's also this whole component that is really focused on the issue of sense making and thinking about the processes and conditions that lead to change. And we're going to talk more about that. And our work internally at the Health Policy Center has focused on looking across different sites in many cases. So there is a cycle to evaluation, and I listed the components of the evaluation cycle here, but I'm going to show you a slide that looks at this from the hypothesis where you elicit a theory, and the theory that you would make, the high-level theory, includes what you expect would be what would work in what circumstances. So you include in certain context, we're doing certain kinds of interventions or mechanisms, and we expect certain kinds of outcomes. So this is the theory stage. And then there is the stage of collecting the data. And I want to say something very important. A lot of times people think that a realist approach is only qualitative. But for a realist approach, you can use any kind of data, qualitative or quantitative. The difference is in the data analysis process, because when you're doing the data analysis, you're organizing the information by context, mechanism, which is I'm going to say a little bit more about, and outcome, and then you're looking for patterns. And so you can organize qualitative and quantitative data and look across this spectrum of context, mechanism, and outcome. And also, then the next part is a theory testing. So once you have gone through this process, then you're thinking, okay, I had this particular theory about how this would work. And what I'm seeing is something maybe a little bit different. And so there's an opportunity to revise the theory and then to go through another round of looking over time. And that's one of the things that Susan said in the introduction, where I was involved in an evaluation that went over years of thinking about a theory, practicing and looking at the evidence, the data, and then seeing how the theory changing or adding to the theory, and then going through that process to gradually build and build something that is more refined and helpful for practitioners. So this statement, the hypothesis, stated as configurations of C plus M equals O, context plus mechanism equals outcome. And the sign of a good evaluation is that it is able to explain the complex signature of outcomes. And so what we think about is that in this complex world, the signature of outcomes is not going to be is going to be complex. So I want to take just a moment to go through the different components of the evaluation. So when you're thinking about the context, you're thinking about the circumstances in which an event occurs, a setting. And this might be, sometimes we look at it in terms of maybe urban and rural, or maybe different kinds of collaboratives that are focused in a different way, or different kinds of geographies, not necessarily rural and urban. But in this, we're looking at who are the individuals, what are the interpersonal relationships, what are the institutions, and what is the infrastructure. So when you're thinking about defining the context, if you ask yourself about these 4 I's, it helps you to describe the context completely. The next part is the mechanism. And one of the things that we think about in the mechanism is, what are the things that are happening under the surface that are not readily observable? I think this is one of the big distinctions of realist work, is that we're thinking about what is happening in people's reasoning, preferences, norms, collective beliefs that influence their decision choices, which lead to the outcome. So instead of going straight from the program activities to the outcomes, you're looking at what is happening underneath. And we know from some of our work in system change that these things that have to do with mindset, which are under the surface, are very powerful in change and so valuable to know about. I think that in some ways for me, understanding and thinking about mechanism is kind of like acquiring a taste for fine wine. It's something that happens over time. And as I have worked more with these issues of really thinking about and understanding mechanism, I've come to appreciate this work of Dawkins and his colleagues, because he thinks about the mechanism in two ways. One is, what are the resources that are put into the context? And this applies a lot of times, it could apply in HHS in situations where perhaps you have certain programs that are being implemented and you are putting money or technical assistance or support of some kind into different contexts. And then the other part of the mechanism is, and what is the reasoning that is happening related to those resources being in the context? And then what are the outcomes that are showing up? What are the mindset changes, the norms, and the outcomes? And so this mechanism, naming it, understanding these two parts of it, like what is done and what is changing in mindset, are two very important components of the mechanism and important information to have in order to be able to analyze the data. So what we're looking for in a realist approach is not what time it is, but how does the clock work? And we're thinking not so much about performance outcomes or targets, although you can look at those kinds of outcomes. But what we're really wanting to see is, what are the ideas that are surfacing? And when you think about Newton's cradle, you know how for you might be putting money in, and then all of those middle balls don't move. And then the one at the end swings out. So what's happening in that concept of Newton's cradle in those little balls as they vibrate and cause the final outcome to show up? So that tells you a little bit about the way we think about outcomes. The other thing that we think a lot about is patterns. And it helps me a lot to think about these seeing patterns. And I'm sure you've all seen some of this. I don't know if you are able to see this pattern, see the pattern in this figure. Maybe put it in the chat if you see it. I can see it on my computer. Is anybody giving any answer about what they see here?
Not yet.
All right. You know how when you look at these patterns, you kind of blur your eyes a little bit and look at it. But what I'll tell you is that in looking at this pattern and the way that you look at seeing patterns, you would see within this a multidimensional image of Saturn, the planet Saturn. So the idea in the realist work is being able to look at the information that you have and being able to think across the context, mechanism, and outcome and see the patterns. So let's just pause. That's the really quick introduction. And just say for a moment, in what ways do you think a realist approach can help you? So you might put your reflection in the chat, or you might think about this a little bit for us to discuss at the end. But just think a little bit about how this approach might be helpful to you in your work. Okay.
As
Now,
we're waiting, Karen, for people to put things into the chat, we are having quite a robust chat about the magic eye.
oh
And
yes,
one person saw Saturn, and most people are very sad that they are not that good at magic eye.
well, and one of the things that we talked about in our planning is that when you're looking at the mechanisms and you're looking at the patterns, having a diverse group of people that might see different things. It's not that you're going to see something different in this particular magic eye, but being able to have diverse groups who see things differently can help the pattern identification be much more robust. And I know that's true for you, and that you have people who are from diverse backgrounds that are involved in looking at things.
And we do have a few responses in the chat. And so one person says that using this approach might help them to cut out all of the fluff, help make sure people don't mistake correlation for causation, help to go beyond theory and move into more practicality and evaluation, a way to engage program partners, putting theory to practice in a methodical and logical way. And someone else says they think it will help with a focus on equity, understanding how rather than just the outcomes should yield a better awareness of unintended consequences.
I love those answers. And I'll tell you part of why I love them is that I've been working with this realist approach for a while, and I've been part of the global community of people who are interested in a realist approach. Most of my colleagues are in Europe, Australia, Canada, Great Britain, although when I was meeting with them last week, they said, don't count Great Britain as separate from Europe. But anyway, that around the world, but not so much in the United States. And so I've really been kind of a champion for a realist approach, using it in our work at the Health Policy Center, we were commissioning research, and we asked each grantee to have a realist component. You don't have to do, it doesn't have to be only a realist approach. You can do an evaluation of a different type, but still have a realist component to what you're doing. So I feel like you, in the way that you've said all of those comments, Susan, we should capture them, because to me, it's an advertisement for a realist approach. And I couldn't have said it better than the people who answered. So going to the examples, the first example is a qualitative case study design. This was an interesting project in which we had several grantees. I'll show you a little bit more about that. And we decided that we were going to have an overall evaluation of this Robert Wood Johnson Foundation funded project, and that we were going to contract with a local evaluator in each site. Might be somebody with evaluation experience or somebody in the university. So what we had was an overall evaluator at the Health Policy Center, and then 7 evaluators that were in each site. And why this was important was because they could be present in meetings where we couldn't be. They could have observation. They'd know which meetings to go to get the kind of data that was desired. And they were involved in the whole process of planning the periodic interviewing and having calls and developing the case studies. And the data sources were transcripts from meetings, interviews, before action reviews, documents, internal meeting information. And the sites were in these 7 states mentioned here across the US. And I just wanted to tell you about this Bridging for Health Theory of Change. I know that you probably can't see every detail about this, but the thing that I wanted to point out from this slide is that it says version 5. So we worked with these sites over a number of years, and we thought in the beginning we were going on with a certain theory of change. And then as we got into it, things changed. And these issues around mindset, the external system, the context, and also the innovation that was occurring in the sites changed and evolved over time and caused the theory of change, which included one of the mechanisms was money was given to these sites. Another mechanism was that there was a tailored technical assistance that was part of it. And so this is just showing the way that things can evolve. And so there was this organizing and coding and summarizing. And so looking at these documents chronologically by site and by type, this was something that was done in a systematic way. There was a broad coding to the evaluation questions and the realist framework, and kind of an ongoing process of making sure that we were looking at the same definitions and reflecting with summaries, and then testing and refining the theories. And just to say a little bit, we got different levels of learning. And that's another thing that I want to emphasize, is that there's the learning that was more targeted toward us at the Health Policy Center about what is working with the technical assistance. And it was, part of it was they wanted more structure. They wanted the modules presented in a particular way. They wanted some clear information about what they were doing in the timelines, and they wanted the language to be clear and concise. So it caused us to modify our technical assistance along the way. And then there were the site level findings. So in each site, and again, this is a lot of detail, but you can look at it if you like, but you can see that they looked at what might be the constraining factors in a site, what were the mechanisms, and what was happening in the sites. And so one of these kind of site level examples was developed for each site. And so we could look at each site, the people in the site could look at this and think about it, and then we could look across sites, and then we could look at what needed to change or what was working related to the evaluation. Another example I wanted to give you is a part of my including this is to say to you, you don't always have to do a multi-year, big, multi-levels of evaluation. You can have a realist way of thinking just on the fly at any time, and you can kind of think about what's the context, what's the mechanism, what's the outcome, and you can look at things with a realist perspective all the time. And this is an example of a rapid retrospective realist evaluation. So in this case, we were looking at the National Network of Public Health Institutes program over 8 years of supporting emerging institutes. And so we developed a quick evaluation logic to describe the context, how did the NNPHI engage, which is the mechanism, and then what were kind of some of the early and the longer term outcomes, and then looking across. My colleague and I were going to a national meeting, and we arrived early and rented a suite and put paper up on the wall, because what we had was what I think of as an unorganized attic of 8 years of data. And there wasn't an easy way to make sense of that information, but yet the board wanted something to help them coming up really soon and thinking about what they might do next. And unfortunately, there hadn't been an evaluation that was in place throughout the course of the Emerging Institute support. So we had multiple cohorts in different years. They had received different amounts of money, and they had more or less mentoring or technical assistance. And so that is the perfect setting for all these different contexts. So there were different types of communities, and the mechanism of the investments were different across communities. And so then you want to say, okay, so what are the outcomes? And this is the wall where we put up the flip chart. We had each of the 10 sites on the left. You can see context, engagement, the early outcomes related to organizational stability, and then the impact. And you can see that we took all of the interviews, the meeting notes, the site visit information, the external look at the viability of the organizations, all of that information, we had it all organized, and we looked at it and by site. And there were some themes that emerged. As you might see a lot of times in your work, leadership mattered. Having a strong leader involved in the Institute mattered. If there was across, no matter what kind of investment or what kind of site, if there was an investment in shared vision over time, this means continuously being in a strategic mindset, there were better early and later outcomes. The other thing was in the sites that had experience with managing complexity of money over time, like re-granting or grant money from different sources, then they seem to be the ones that had more success. And then there were these issues of geographic disparities, like rural versus urban, and in the state. And then the other thing is the geography in the state. And in the states where they were long states, like Tennessee or Florida, or other states where travel might be a barrier. Travel might be a barrier in a long state more than a more compact state. And in Hawaii, there's a lot of travel kinds of changes. This created different kinds of challenges for the emerging institutes. And so some of the thinking was to think about some most significant change story interviews, which is a nice complement to this work, to think about in terms of membership and support, how might NMPHI support in making these things that seem to make a difference, like leadership, complex money management, and shared vision over time, recognizing the challenges of geographic isolation and also disparities across geography. And so to continue this for learning. So those were some of the steps. And this was something that happened over the course of about a month, that we did this work on a weekend, and then we put together and presented it at the next board meeting. One of the things that I like to think about is that this process, in this case, it was just a single round of sense making, but with the other example, it was a larger multi-cycle, so that you have some practice, you get some data, you do some big picture sense making, you see what the implications are for action, and then you move into another practice cycle. And this is a balance. Once you have one iteration, you learn something and you're able to move forward. But as you do future iterations, you're able to refine and revise and still learn in each cycle. I also wanted to share just a little bit about how the work can be very practical. So one of the projects that we did was with the government for Ireland, and they were looking at the challenges that they had with co-occurring mental health and substance use. And their system is, even though they have the universal coverage, the coverage for behavioral health and was under the system, but the coverage for substance use was separate and was handled separately, and it was not integrated. In some ways, it seemed like the United States, in the way that we sometimes have separation or fragmentation in our system. So we did the Realist work. We were present in the country, and we met with the providers and the users of the services. And we did this comprehensive Realist review of literature that also included input from the people in the country. But we wanted to do something more practical. And so we created a document that said, if we were the Irish government, what are the policy and system kinds of things that we might do? What are a few preliminary action that might happen? And one might be something about aligning or the alignment of the resources. And at the organizational provider level, it might be something about building a knowledgeable workforce, because what they had was people who were knowledgeable in one part or the other, but not both. And maybe as it relates to the individuals, there was a lot related to having the individual at the center of care and the importance of including the family. So there were several recommendations in each of these, which were a much more practical outcome of the Realist work that would allow the government in Ireland to think about some things that might happen early. And then there was the 100-page discussion and looking at all the details about the mechanisms, and a lot more detail than could really be actionable by those who are trying to make policy decisions. So when I think about this work of Realist and using it, I think of it as an opportunity for us together to understand our world and the complexity of our world, and to be able to make sense of the world. And we think in terms also of what are the attributions and the contributions that come about. So this is the content that I have to share, and I welcome you to take a few minutes, and perhaps, Susan, there might be some questions that are emerging that we would want to touch on.
Yes, we do have a couple of questions so far. And so everyone, please put any additional questions into the question and answer module of the Zoom. But one question was the result of the NNPIHI Emerging Institute evaluation published?
Oh, I wish I did publish that, but we didn't. I guess we should have, and maybe I guess we still could. But yes, it was mainly focused on providing support to the board to take action. And it did have an impact because they thought about the big states in the middle of the country that didn't have institutes, and they were wondering, like, why don't we have institutes in that? And that because of that big geography and dispersed population, and they realized that they might need to take a different approach in how they thought about if they wanted to expand public health institutes in particular states. so it had an impact on the mindset of the board in that regard.
Okay. In that same vein, if there are some evaluation reports that have been published or that you can share with us, we can put links to those in the materials that we post after the webinar. We have another question. When adapting to new changes, for example, bridging for health theory of change models, how does one ensure bias doesn't negate the evaluation of outcomes?
I guess you're thinking about as you look at the content, mechanism, outcome information. Well, I think that one way that happened was in the careful coding of the information and having kind of multiple coding checks so that there was consistency in the coding of the data. The other thing that I mentioned early is I think having a team that's looking at the patterns creates a broader sense of the patterns. And we've done this in multiple ways, because you can't just give everybody all the data because they don't have enough time to look at it. So there might be a first round of some sense making with a smaller team, and to say where it looks like these patterns are emerging, and here are the, you think of context, mechanism, outcome strings, like what is a string, and you think of those examples. And then if you share that with a larger group and you're giving them enough information that they can participate in the sense making without them having to go to every detail. But we're seeing these 8 patterns, and here are the strings of context, mechanism, and outcome data that support these patterns. How does this look to you? Does this fit with what you're seeing or what you're experiencing?
Another question, and I'll admit this is my question actually, as you talk about accounting for context and thinking about the mechanisms, there's so many contextual influences. Do you have some suggestions for how you select or identify the most appropriate contextual factors to consider in the evaluation or to focus on in the reporting out?
Yes, that's a good question. As you can notice from these 2 examples, the contexts that we looked at were different in each of the 2 examples. So I think that what you have to do is think about the context information that is relevant to your theory of change, because you can't look at everything everywhere. But what might emerge is you have a certain context, things that you're looking at related to your theory of change. But when you get around to the point of the sense making, you see something else that seems to be a component of the context that seems to be making a difference. And so then you might, in your second round, either collect more data, or you might have data that you could put into that context and look at it again. So in some ways, it can be an iterative process. But I think starting with what are the, not getting too many, what are the contextual items that make the difference based on our theory of change, or we think will make the difference, and then building out from there.
Thank you. That sounds like an excellent starting point. Another question that we have, what are some challenges that frequently occur in realist evaluation?
Well, I think like if you think about that picture of the attic, and you think about sometimes all the information that you have, sometimes I think of it as a plate of spaghetti full of information, and you need to take that information and place it into this kind of context, mechanism, outcome, sense making, or data analysis. One problem is when you are later in your process and are going back retrospectively, you might not have all the data you wish you had related to context, mechanism, and outcome, or the data are not organized in that way. So it can be time consuming to sift through reports and transcripts of meetings and conversations to find the context, mechanism, and outcome data that you need. It's much easier if you start from the beginning, like we did with the one example. That's one of our best examples, where we had the theory of change to start with. We had the way of collecting data together with our partners from the beginning. And so the process, even though it was complex, it was easier than if you're doing it retrospectively. I don't want to discourage you from doing it retrospectively. I just want to say sometimes that can be a challenge.
Excellent. Another question, how should we be thinking of data collection for capturing the things that are happening underneath?
Well, I think that goes to that second figure I showed you about mechanism. So when I think about the mechanism from that figure, I think about, okay, what are the resources that are being applied to the context? So what money, what technical assistance, what other kind of support, staff, whatever it is, the resource, and that is being applied. Or it also might be the program that is being implemented, like somebody is implementing a program for children's obesity, or something about maternal health, or something about housing. It's something like what is the resource and what is the intervention? So that's one part. And then to be able to watch for in conversations or in interviews, how people are changing the way that they're thinking. We implemented this program and it caused us to think differently about how we choose our patients, or how we use our data, or many different things can come up in the reasoning component. So that's the complexity of the mechanism, is what's the resource and the intervention, and then what are the things that are happening in the mindset and norms in the way that people are thinking, and how does that impact maybe some early outcomes and then the later impact outcomes.
Thank you. And that actually makes me think of another question from myself. In talking about people and how they're thinking, how they may be changing their perceptions or awareness, their thought patterns, things like that, can it also be applied to organizations and organizational thinking and culture and processes?
I think, yeah, that's a great question. And it leads right into one of that last slides I had, where you're thinking in terms of the policy, the organization, the providers, and the individuals in that case. So you could be thinking in terms of policies that happen. That's really, if you get all the way to a policy, you're getting toward an outcome. But you can what if people are talking about changing the policy? Or what if they're talking about changing something about a policy, or changing the way people work together in an organization, or even who should be on a team? Or, one of my favorites is, this might work better if we were more connected with the community and we had a more powerful community voice from the beginning in our work. So those kinds of changes that can be at any level of policy organization, practitioners, interventions, or at the individual level.
Well, thank you. And if there are any last minute questions, please put them in. But otherwise, thank you so much for your presentation, your expertise. We really enjoyed your presentation and appreciate you coming to speak with us today. And we do have a poll feedback from the participants, so that should be coming up right now. Let us know what you think about this session and the sessions that we've been doing in general. As evaluators, we like to evaluate what we're doing as well. So please answer the poll about what we've been doing. And if one of the support staff can put the details about the next training, I was trying to paste it in there and I couldn't get it in there. So in terms of September 14th, we have another training, and it's about communication, how to communicate information in a useful and easy to understand way for various different audiences. It's called Adapting and Framing Evaluation Results to Encourage Action. It'll be September 14th from 12:30 to 1:30. And I believe that the materials went out, and so you can always go onto that link. There's no pre-registration required. Thank you for putting it on there. Somebody said, can you please check on question 2 on the poll? It only allows for negative responses. So there may be an issue with the poll that we have up. Thank you for pointing that out. We'll certainly take that into account when we do our analysis. Oh, and then somebody else responded. You have to scroll down for that answer. So we'll give another minute or two for people to answer the poll, but thank you very, very much, Dr. Minyard. We really appreciate it, you coming to speak with us. And thank you everyone for joining us and for sticking with us through the session. And we do have a couple of comments, Dr. Minyard, just to let you know, saying how much people have enjoyed the presentation. So for everyone else, we will be posting the slides, the recording, and the materials that were in the chat on the ASPE Strategic Planning Resource Center. We're hoping it'll be in a few weeks, but we will send that out to everyone to let you all know when you can access the information from this session, the previous 3 sessions, and our future sessions. So thank you, everyone, and we'll leave the Zoom open for another couple of minutes for those of you that may still be working on the poll, but thank you all and have a good rest of the day.